All aesthetic injectors need to know this. Anatomy isn't optional. It's the difference between a good injector and a safe, strategic, and exceptional one. Behind all those anatomical terms are a few key takeaways that are non-negotiable if you want to practice aesthetic medicine safely and effectively. Hi, I'm Dr. Kylie Melton. I'm a board-certified physician, injector, and med spa owner. And this is a no-nonsense anatomy education I wish I had when I started injecting. In this series, we're breaking down must-know aesthetic anatomy, starting with the foundation, the bones. In today's video, we're walking through the essential bony landmarks of the face, how the bone structure changes with age, and the specific foramen you never want to inject over. Let's get into it. Let's start with the palpable bony landmarks, the ones you can actually feel during your assessment. First up is the mandible. That's your jawbone. This gives support to the lower third and is key in chin and jawline contouring. The gonial angle is that sharp corner at the back of the jaw. It's often more prominent in males. Just anterior to that is your antegonial notch. This is a helpful landmark that often aligns with where the facial artery passes, and you can feel this right here. Next is the maxilla. It sits beneath the midface and supports both the cheek and the base of the nose. Then we have the zygomatic arch. This is what gives the cheek its projection and structure. Going back to the upper face, we have the orbital rim, which surrounds the eye socket and becomes more visible as fat pads diminish with age. And finally, we have the temporal crest. This is a raised ridge that extends from the lateral brow into the temporal region. It's subtle, but becomes more apparent as patients lose volume. These aren't just fancy terms, they're landmarks that guide how deep we inject, what angle we use, and how to stay in safe planes. Now let's talk about bony resorption. Your 25-year-old patient and your 65-year-old patient have completely different foundations beneath their skin. As we age, the orbital rim widens, and this contributes to a hollow appearance around the eyes and a more tired appearance. The maxilla flattens and shifts posteriorly, and this is going to reduce your midface support and exaggerate your nasolabial folds. The mandible resorbs, especially at the lower border and the mental region, and this can lead to jowls, soft jawlines, and a recessed chin. If you understand where this resorption occurs, you'll stop chasing superficial lines and start treating the real cause, the structural loss. This does not negate the fact that we will need to do some fat pad improvement, but we'll get to that later. Knowing how the bones change is going to change your treatment plan. Now let's talk about the foramina. These are tiny holes in the bone where critical nerves and blood vessels exit. These are your anatomical danger zones, and knowing them is non-negotiable. There's three primary ones I want you to remember. First up is the supraorbital foramen. This is just above your orbit, near your brow bone. You can palpate this, and it serves as a reference point for the others because they align in a vertical plane downwards. Your infraorbital foramen sits just below the orbital rim, lining up with the pupil. It contains the infraorbital nerve and artery. Your mental foramen, found below the corners of the mouth, is typically in line with your second premolar, and this is where the mental nerve exit. We inject near this often, so it's important to know where this is. Why does this all matter? When we're treating a patient with dermal filler, we're not just filling space. We're restoring volume loss, supporting aging structure, and working around high-risk anatomy. If you don't know where these bony changes and foramen are, you're more likely to create unnatural results or worse, cause complications. By treating areas of bony resorption like the midface, the jawline, and the chin, we can create a more natural, age-appropriate outcome. You're addressing the root cause and not just masking the surface. When it comes to the foramina, knowing their location helps you avoid dangerous complications like vascular occlusion or blindness, and it also makes you more effective at performing nerve blocks if you're able to do those for pain control during treatment. It's not just academic, it's clinical, it's safety, and it's about results. If this helps you feel more comfortable in your approach as an injector, do me a favor, hit the subscribe button. This is just the beginning of our aesthetic anatomy series. Thanks for being here. I'm Dr. Kylie Melton, and I'll see you in the next video.